The World Health Organization says Africa risks a massive meningitis outbreak. The WHO says in just the first 6 months of 2015, 12,000 cases of meningitis C have been reported in Niger and Nigeria, with 800 deaths. Meningococcal meningitis is a bacterial form of meningitis, a serious infection of the thin lining that surrounds the brain and spinal cord. The disease can cause severe brain damage and is fatal in 50% of cases if untreated. Dr. William Perea is WHO's coordinator for control of epidemic diseases.
This serogroup is re-emerging in Africa. Our best weapon to control this disease and meningitis in Africa is vaccination. And we have two-pronged strategies. One is preventive vaccination, to give the vaccination to a cohort of people to have a long-term protection of the population. Unfortunately, we don't have the right vaccine available for that.
That was Dr. Olivier Renvaux with WHO. Now the International Coordinating Group for Vaccine Provision for Epidemic Meningitis Control are calling on vaccine manufacturers to step up meningitis C containing vaccine production by 5 million doses before the 2016 meningitis season starts in January. Scientists have long been trying to develop an effective protection and cure for malaria, one of the deadliest diseases that affects people in tropical areas, especially children, as the World Health Organization announces plans to begin clinical trials of a promising new vaccine. Scientists in South Africa report that they too are at an important threshold. VOA's George Putic reports they are testing a compound that could be a single-dose cure for malaria.
It looks like the race to find a cure for the disease that infects about 200 million people annually is close to the finish line, as several research groups report successful initial clinical tests. In 2013, some 600,000 patients died of malaria, most of them children in sub-Saharan Africa. Working in cooperation with scientists in Switzerland and Australia through the non-profit Medicines for Malaria venture, researchers at the University of Cape Town report their new drug, MMVO48, is very promising.
We've done extensive safety testing as a requirement, and thirdly, we've looked into the process of manufacturing the drug on a large scale.
Kelly Chibale says in the first phase of human clinical trials, the drug instantly killed even the drug-resistant strains of malaria parasites.
Of course, there is a long way to go. The potential that this compound offers is more than just the potential to impact malaria control, but also the potential to impact eradication, because it's able to block transmission.
The number of malaria-related deaths has been reduced by 47% over the last 15 years, mainly through use of bed nets, spraying against mosquitoes, and therapies based on existing drugs. George Putic, VOA News, Washington.